Hello, so my name is Professor Anna Harris, and I'm going to talk in this presentation about factors that can impact warfarin and can alter INR levels. There are a lot of things in somebody's lifestyle, like their diet, what they drink, activity levels, medications, that can impact warfarin and INR levels, and it's important that patients are aware of these different variables. So in this presentation, we'll go through all of the different ones and how they impact the warfarin, why they impact the warfarin, and what they're going to end up doing for the INR levels. Also, we're going to talk through what you will be wanting to educate your patients on in terms of maintaining consistency, which you'll hear a lot of during the presentation, as well as when they need to let their anti-coag clinic know that one of these different things has happened or changed, or they've started a new medication, so that their INRs can be monitored appropriately during that time. All right. So first we're going to start talking about vitamin K rich foods and drinks. Vitamin K is the reversal agent of warfarin. And so foods that are high in vitamin K can have an impact on the warfarin. Some of the ones that are the main ones that have a lot of vitamin K, the biggest thing we kind of talk about is dark green leafy vegetables. So we're talking about spinach, kale, broccoli, Brussels sprouts, collard greens, cabbage. All of these have a lot of vitamin K in them. So patients need to be aware of the foods that have a lot of vitamin K, and they don't need to stop eating these foods. The biggest thing with diet and warfarin is just to maintain consistency. So whatever your normal diet is, whatever a patient's normal diet is, they want to just keep that up. So if they have 2 to 3 servings of broccoli or greens a week, then they want to kind of just maintain that. There are some kind of freebie foods that we talk about. Iceberg lettuce is one of those. So if patients want to have salads and not really have to worry about vitamin K, iceberg lettuce is very low in vitamin K, so it's a good option to use in salads. Your spinach, your kale, even your romaine lettuce can have more vitamin K in it. So that, again, it's fine if patients want to have that in their diet. They just want to try to be a little bit more consistent with that amount, be a little bit more aware of how much they're eating. Green tea also can have a lot of vitamin K in it. The hot green tea generally has more vitamin K than the iced green tea or the type that you can find in bottles, but it can be actually rather potent. A lot of times green tea can be used when patients are trying to lower their INR in preparation for procedures. Sometimes we will find that we will use green tea to help them get their INR lower. So we'll actually kind of prescribe some green tea to help lower INR. So it does have a lot of vitamin K in it. Protein shakes like Ensure or Boost is another option, can have vitamin K as well. So it's just important that patients are aware that if they start drinking these on a more regular basis, that you might need to check their INR a little bit closer, might need to adjust their warfarin dose based on that. So again, vitamin K rich foods, they will decrease a patient's INR. So alcohol. Alcohol in and of itself is a blood thinner, so even if a patient is not on warfarin and they have some alcohol, their blood might be a little bit thinner, might be a little bit more at risk for bleeding. So alcohol and warfarin really don't mix great together. The recommendation for alcohol is to really be minimal with it when you're on warfarin because of the risk for bleeding with that. That being said, consistency can help with that. At our clinic, we do have patients who drink a regular glass of wine each evening, or a couple drinks during the week, and that's kind of their normal. And we can adjust their warfarin dose to kind of compensate for the alcohol that they have in their diet. The biggest thing is binge drinking is a big no-no with warfarin. It puts you at a really unsafe risk for bleeding. So patients just really need to be aware of their alcohol intake, and definitely moderation is the key for this as well. So again, alcohol will increase in INR. So there are a couple foods that just don't really fit into a specific category, but they can impact the INR levels. So one of them is cranberries, and the other one is black licorice. So, not a lot of people are going crazy with their cranberries and their black licorice, but you find at those times when you've got a patient coming in with a high INR, and you're not really sure why, and all of a sudden you start talking about black licorice and you realize they've been binging on it. That might be the reason why. So both cranberries, black licorice, they can increase INR. Illness. So a lot of different things that can impact the INR, and the mechanism can be different depending on what the illness is. Vomiting and diarrhea, a lot of times INRs can be higher with this. Generally, you're not having your normal diet. When the body's under a lot of stress, you can have higher INRs. The warfarin might be hanging out in the system a little bit more, which is what's increasing the INR. Pain as well. Typically, you can see higher INRs. Sometimes you can see lower INRs. It's really just a stress on the body, and it can have variable reactions. Respiratory illnesses are the same way, and a lot of times with respiratory illness, you're taking over-the-counter medications, or you are on an antibiotic, and we'll talk about that a little bit more in one of the further slides, but absolutely these can impact your INR levels. So the thing that we tell our patients is that any illness that's lasting longer than 3 days, we want to check their INR. We want to make sure that we are decreasing the warfarin dose if needed or adjusting as needed, because sometimes illness can actually decrease INRs as well. So variable responses, and so down at the bottom here it says it can both increase your INR and it can decrease your INR. Exercise. So exercise is great. With warfarin, you do want to be more safe with the activities that you choose to do exercise with warfarin being a blood thinner. You don't want to do a lot of workouts that could potentially where there could be any sort of physical impact, like you wouldn't want to go play football or or wrestling or rugby or something like that, where there's a higher chance for there to be physical injury. That being said, walking, jogging, riding your bike, as long as you wear a helmet, all of these are absolutely appropriate exercises and can still be done while a patient is on a blood thinner. The thing that is important to note about exercise, though, is that with the more that you exercise, it can increase your metabolism. So then when your metabolism increases, then this can affect the rate at which the warfarin is absorbed and then excreted from the body. So generally, with increased exercise, that means increased metabolism, and it can mean decreased INR. The warfarin is essentially getting through somebody's system faster, and so you need a higher warfarin dose to compensate for that. Stress. So stress can affect the rate of metabolism as well. A lot of times it actually can slow down metabolism, so somebody might end up having more warfarin in their system at one time, which can increase somebody's INR. So increases INR is absolutely something that is seen with stress. This can be physical stress like pain or something else going on in the body. It can also be emotional stress, anything that's really triggering that fight or flight response and putting somebody under their body under more stress. I also put on here, though, decreases INR because there can be variable responses with stress as well. It really all just depends on how it is affecting a person's body. So again, this is a good question to ask patients, especially if you've got an INR that is high or low and nothing else is really coming up as a good reason. Stress can honestly just be the thing that is impacting their INR levels. And so you might have to adjust the warfarin accordingly. So medications. So there are a lot of medications that interact with warfarin and that can change the INR levels. Some of the bigger ones, we've got antibiotics and we've got steroids, oral steroids in particular, of course, IV steroids, topical, usually not as much. But antibiotics and steroids, we generally see much higher INRs with those. So those are the ones that we tell patients to let us know, let the anti-coag clinic know as soon as possible once they start on those medications, because we want to keep a closer eye on their INR. So NSAIDs, so that category of medications, the nonsteroidal anti-inflammatory drugs. So we've got our ibuprofen, our Aleve. There's a whole group of medications that fall under that. So the risk with those is that they can cause bleeding complications just on their own, and so then you add warfarin onto that, and there's a much higher risk for bleeding, especially intestinal bleeding or bleeding in the gut. And so the general recommendation is to actually steer away from those medications for patients. Generally, they will increase the INR, and so at our clinic, we tell patients that unless their doctor has specifically prescribed that for them or recommended that for them, knowing that they're on a blood thinner, that they should steer away from those. Tylenol is the more recommended medication if somebody needs something for like a headache or for light pain. And so that can be, of course, found over the counter. The thing about Tylenol is that it does get metabolized through the liver, and that is the same place that the warfarin gets metabolized as well. So if you're doing a lot of Tylenol, so it's not just, once a week because of a headache, but you're doing it on a more regular basis, or a patient's doing it on a more regular basis, it can end up kind of clogging up the liver and making more warfarin in somebody's body at a time, so it can increase the INR. So generally, it's important to tell patients that Tylenol is the preferred over-the-counter for headaches, colds, pain, stuff like that, but that if they're going to be taking it on a pretty consistent, regular basis, that they should let their anti-coag clinic know, so that they might need to adjust the warfarin based on what the INR level is. Over-the-counter medications, there are just a ton, and they all can do different things. They all have different interactions with the warfarin. So we generally just include this in the medications that we'd like for the patients to let us know if they are changing or doing something different with. Herbal supplements, same thing. A lot of different ones, and they can all impact the warfarin differently. And so we just want to have the patients let you know that if they've started or they've stopped, or what their normal routine is with herbal supplements, so you can kind of keep an eye on that. Multivitamins, the biggest thing in multivitamins is the vitamin K, as we talked about earlier. Some multivitamins do not have vitamin K, so it's less of a concern, but the ones that do have vitamin K, again, it's going to be a big thing if a patient has stopped a medication or started a new medication with the multivitamin. Then we would like to know at the clinic, let the patient know that they should tell their anti-coag clinic, because they might need to have their INR checked a little bit more frequently, especially when they first start or stop a multivitamin that has vitamin K in it. So again, there's those two responses. They could increase the INR, they could decrease the INR. The biggest thing that we tell patients is just to keep us in the loop. Let us know what's going on with their different medications. If they've started, they've stopped, they've changed a dose of a medication, and then we can determine if that's one that might impact the warfarin, and then maybe check INR a little bit more frequently right after they make that medication change, just to make sure the warfarin dose is still appropriate. All right, and then there are my references. All right, thanks, guys.